Client came in and states that she is not an athlete and doesn't exercise, but does like movement for mood elevations. The chief complaint was fatigue and dizziness. You have a 15-year-old female whose height is 5'7", weight is 107, usual body weight is 123 pounds in the past year. The high weight was 123. Patient has a low pulse at 56 and a low blood pressure at 110/56. Patient is taking multivitamins and laxatives occasionally for constipation. Previous medical history of anorexia, purging type, Russell's signs on dominant hand. Labs revealed high sodium, low potassium, low chloride, and an increase of the red blood count and hematocrit and amenorrhea. Labs also showed positive mononucleosis. Observations was a bony protruding clavicle, lanugo, low lean body mass, depression on the temporal region, arrhythmia, swollen tonsils, inflamed gums, a heart murmur, bilateral enlargement of the lymph nodes in her neck, prominent PMH, point of maximum impulse, visible, and bradycardia. My assessment is that this patient is suffering from anorexia nervosa, purging type, self-induced vomiting, and excessive exercise and laxatives. The plan here is to check her amylase to confirm if self-induced vomiting is happening, get the growth curves to be able to reference weight, height, and size over the past years, refer her to a therapist or a psychiatrist for her depression, also referring her to a cardiologist because of her having the bradycardia, the heart murmur, and the PMI on her heart as her father died at the age of 50 from an AMI. Patient will continue the multivitamin, increasing her fluid intake as her blood work shows signs of dehydration, as well as taking an oral electrolyte replacement like Pedialyte or Body Armor, 8 ounces 3 times a day. And patient will start 6 small meals per day, checking labs 1 to 2 weeks after starting that meal plan, as well as increasing the calorie intake every 1 to 2 weeks. Patient's meal plan is to help her gain a pound a week, as well as making sure she's not at risk for refeeding syndrome. So the meal plan is a weight restoration plan. Patient will have a 2,100 calorie meal plan completing these exchanges. So she'll have breakfast, AM snack, lunch, PM snack, dinner, and bedtime snack. So for breakfast, she's going to have 8 ounces of dairy, 2 exchanges for protein, 1 exchange for grain, 1 exchange for fruit, and 1 exchange for fat. For AM snacks, she's going to have 1 exchange for protein, 1 exchange for grains, and then 1 exchange for fruit. For lunch, she's going to have 3 exchanges for protein, 2 exchanges for grains, 1 exchange for fruit, 2 exchanges for vegetables, 1 exchange for fat. For PM snacks, she's going to have 1 exchange for protein, 1 exchange for grain. For dinner, she's going to have 3 exchanges for protein, 2 exchanges for grain, 2 exchanges for vegetables, 2 exchanges for fats. And then bedtime snacks, she's going to have 8 ounces of dairy and then 1 exchange for grain. And that will equivalent almost to 2,100 calories.